Okay, my people, so now we go discuss the other things where they cause impaired host defense mechanism. Now, the other point where they cause impaired host defense mechanism where go can lead to pneumonia, in this case, now accumulation of secretion. Okay, you get disease or medical condition where they call cystic fibrosis. Okay, when you go see accumulation of very thick, mucus and mucin, where go they accumulated, particularly in the lower part of the respiratory tract, the lungs, we go can lead to infectious processes. We will discuss cystic fibrosis because na condition where they also fairly enough popular among people. Okay, so cystic fibrosis. Okay, when there's accumulation of this secretion, when you see you go can introduce a lot of bacteria, we go can come there, then can cause this particular thing where we no want make it happen to anybody, whether they call pneumonia. Now the next thing which will also cause problem with the host defense mechanism, now interference in the bactericidal function of the alveolar macrophage. I will take them again. Interference, something where they stop them. In the bactericidal function, something where they stop the bacteria function of alveolar macrophage. Okay? Now remember, I've been talking, say, for the previous slide, I've been talking, say, inside the whole respiratory system, we get the pseudostratified ciliated columnar epithelium, but we don't get them for alveoli. And say the function of that pseudostratified ciliated epithelium, now for him to comot the dust and all the yamayama we don't breathe in. Okay? But why there for alveoli? So you go ask yourself, say, if there for alveoli, so how alveoli they comot all these things? Alveoli gets one organ where they for inside the system, and that organ then they call them macrophage. Okay, macrophage now one particular kind of cell organ where they help. Okay, they chop, they engulf, they take away this debris from inside the alveoli. They chop them, then disintegrate and then destroy them. Okay, I say God they wonderful. See the way thing God do. See that side we not gonna need that cilia. So therefore, he gonna bring alveolar macrophage. So anything where they interfere with the function of this alveolar macrophage, it will cause this alveolar macrophage not to function. And if you no function, you already know what thing will happen. You get. It will come lead to accumulation of all these particles and this debris inside the alveoli, and when the alveoli they accumulated with this debris, something will happen. Pneumonia will happen. Okay, that is the condition. So it is very, very important. Make you take note. So now cystic fibrosis, which is in the case of accumulation of secretions, and also we're also talking about when the interference of the bactericidal function, when the function is interfered. Yeah, when it's interfered, it will lead to that as well. Okay, very good. So now, make we talk about the other things where they decrease the host resistance. Okay, those things where they cause the host resistance. This your resistance. Something where they cause and make it decrease. Because when you don't weak, you don't decrease. What be those things? Immunodeficiency. Okay, immunodeficiency. When sometimes this immunodeficiency they caused by when you take immunosuppressive drugs. Okay, they get drugs where they decrease the immunity. They're good for other, they help for other area, but it decrease the immunity. So these immunosuppressive drugs will lead to immunodeficiency. And if there are immunodeficiency, it means that the body no fit fight, these microorganisms where they come. And if the body no fit fight this microorganism, what thing will happen? It go cause infection, particularly of the pneumoparenchyma. Pneumoparenchyma. I talk about where now. Okay, and when there's infection of this pneumoparenchyma, what thing will happen? It will cause pneumonia. Another thing in the case of leukopenia, leukopenia, it means say when leukocyte they completely reduce below the norm. When the whole white blood cell wey dey for your body, you get blood cell wey we call white and the one wey dey red. The white one na the one wey particularly dey help the fight against infections wey they call, for example, neutrophil. Na be the first oga when infection come your body. Neutrophil go come there, come do like this, you know. That neutrophil and those white bloods, when they low in your body, imagine say you want fight, you know, a whole battalion of army and you dey alone. You see, you know, they proportionate. So when it dey low like that, you know, problem dey. You understand my friend? So now the point be that. So when particularly there is decrease, then they decrease in the white blood cell amount, it will lead to, you know, this disease to fit develop, because nothing go fit fight this invader, this microorganism where they invade. It say comes to steal, kill, and to destroy. So every microorganism where they come your body, they come, they kill, destroy, and take away everything where they good. That is why we need to stop this microorganism. We need to give them, you know, boom, boom, boom. In Daboski style. Okay? So this is another very important point. Okay? So I said the first one is immunodeficiency. We will talk about immunity later, because immunity is one of the things where they help prevent us from getting a lot of diseases. So even if the disease come, or infection come, if you get very good immunity, if it fight for you. For example, this coronavirus we been there now, we still there with us. Most people no get, we been get the virus, no even know say them get them, because their immunity been there strong and their immunity been fit fight against the virus. So some of them, you see, they go test them, then get them, but they still they can't pay. It be say their immunity they strong. So somebody need to build, you know, and get strong immunity in order for the person not to fall, you know, prey and easily infected and have some, for example, this thing what they talk about today, pneumonia. So we get two types of immunity. We get innate immunity and we get, of course, cell-mediated immunity. But particularly, we will talk about more of cell-mediated immunity. Understand? Because when these cells have been affected, we can't get particularly this pneumonia what they talk about. Understand? So now I go do a general overview of what we don't talk so far. Okay, we just discuss, say, for the previous slide, say we get things where they cause pneumonia, where the predisposing factors, where if them day, your chances of getting pneumonia go day high. Understand? So that thing, for example, decrease of the host resistance, and also problem or impaired defense mechanism. So we'll talk about all those defense mechanisms, and also talk about what cause the host resistance to they decrease. So right now we'll go move over, we'll come talk about the actual causes, the etiology, the things where they cause, you know, this particular infection or disease, this particular microorganisms where they're responsible to cause this particular disease. Okay, so see you in the next slide. I want to make you take your book and your pen, sit down, write them down, so that you go understand the idiots, them sorry to say, but no sorry, the idiots them where they cause this pneumonia. See you in the next slide.